I'm Holly Ruffles, and today I'll be doing a video on discharging a patient from surgery, which in this case is a dental prophylaxis on a cat with no extractions required. So just for the purposes of this video, I've prepared some cheat sheets to make sure I don't miss any points. So this is our patient today that we'll be discharging. So this is Captain. So I'll just check his admission form that's on the front of his cage and just check the description to him. So Captain is a black and white male, domestic short hair, and that looks right. So, alright, and this is Captain's cage, and we'll just get Captain out of the cage into here. Pop him in his carry cage, securing the door behind him. From here, I'll just take him through to consult 2 to discuss his general health check. Make sure you close the door after me. Just get him out and discuss what we've done with him. So, I've removed the bandage on his catheter site on his front leg, and I've also wiped that free of any blood or mess that was there. He's had a post-discharge TPR performed on him, and all the values that he had were normal. So we measured his heart rate with a stethoscope. We used a rectal thermometer to measure his temperature, and we visually assessed his respiratory rate, which can often be difficult in cats. So obviously Captain is not showing any signs of pain. He's quite a happy cat, and he's recovered really well from his anaesthetic. So the signs of pain that you might expect in a more major surgery patient would be if they were hunched up or depressed and not interested in life, and whining or crying. As he's just a minor surgery patient, he's had an anti-inflammatory injection which is long lasting with us today. And for now, I'll pop you back in your cage. Okay? You're so cuddly. There you go, bud. Sorry, bud. Alright, now I'll just bring him through to reception. So I've prepared some discharge and aftercare instructions to give to Mr. Ruffles, and these just contain information on his anaesthetic recovery time, what to expect after surgery, the food that is best fed immediately after, some dietary recommendations in the long run, recheck requirements, and medication, although in this case that's not applicable as Captain does not need any. So now, oh hi Mr. Ruffles.
Hi.
Here to pick up Captain.
Yes, how's he going?
He's done really well. He's woken up from his anaesthetic beautifully. You shouldn't notice too much of a difference. Alright, so for today, everything went just as we expected. So he just had the grade 1 teeth scale and polish under the general anaesthetic. No extractions were required. His teeth were absolutely lovely. So for some aftercare instructions for you. So the general anaesthetic, for the next 24 hours maybe he'll be a little bit groggy does seem pretty good now. If you could just keep him warm, like an ambient temperature room, and maybe just confine him to a room just to keep him quiet. And if you have any other pets, to keep him away from those pets. So if he eats all his, if you give him a half meal of his normal food tonight, and then if he eats it all, you can give him the rest, maybe half an hour later. From now on, he can have water available at all times, just as you've had, and his normal feeding timetable can start tomorrow. So no medications, so it's a usual routine procedure. He's had a long-acting anti-inflammatory injection administered today. Hello, how are you? Alright, so the benefits of that will last 24 hours, and by then he should be feeling better. So for his oral hygiene, it's important to maintain his home care routine. And we do offer free dental health checks, so if you ever have any questions, or maybe you could make those a 6-monthly thing, bring him in for those, absolutely. And the maintaining the dental health, it's important because it not only protects teeth, but it protects against other conditions that can develop from diseased teeth and gums. So I've included a sample of Hill's TD feline in here. So TD is a specially formulated dental diet that's a complete nutritionally balanced diet that has a unique kibble shape and size that will clean the tooth and remove bacteria. So you can see if he likes that and continue on that. But I wouldn't try that straight away, maybe in a few days, because it is quite a hard food. You are already giving him greenies, so that's fantastic. There are a couple of other options you could give to him, such as water additives, but I don't really think that's necessary for him. One thing that you can do, and he's quite a patient cat, so he might tolerate it okay, is you can use a toothbrush and some pet toothpaste. Just if you just scoop up a bit of the toothpaste on the finger brush, and we sell those here if you're interested too. Scoop up a bit and then just rub it in circular motions around it, and it's safe for them to swallow. So, do you have any questions?
No, I don't think so. I think you've covered most of my concerns, I think.
Good. Alright, so you can take this little pack home. It's got a brochure for the dental food.
We'll have a look at that.
And a sample of the food as well. So Captain doesn't need a revisit. So because everything was just routine, he's fine to just go home.
And will you send out a follow-up in, say, 6 months' time?
Yeah, we can do if you like. I can make a note on your file. Yeah. This is for you to keep as well, just with some information on what we've done today, and just cementing what I've told you as well.
Right.
Now.
Okay.
Alright, so if you don't mind, we'll just settle the account now.
So that was
391 it came to. So now I would put through 391 on our FPOS machine. Obviously I won't do this because we haven't done it. But and also I will print an invoice that's computer generated from the patient's file as well, that documents each item that he's had today. Alright, so that's about everything.
So I've got everything. I've got my instructions, my sample,
yeah, and if you
and
have
my captain.
Yes, and if you have any questions, we're open from 8 AM to 7 PM on weekdays and 8 till 1 on weekends.
Okay, that's good.
So don't hesitate to give us a call. If anything goes wrong, that also has emergency contact accounts and clinics as well.
Okay.
Alright, no problem.
Okay, thank you, Holly. I'll just walk out the door with Captain.
Alright, that concludes video on discharging a patient from surgery, so a dental prophylaxis on a cat with no extractions. Thank you.